Good afternoon, everyone. My name is Tiffany Lopes, and I am the Director of Communications here at the UCLA Center for Health Policy Research. As a land-grant institution, we would first like to begin by acknowledging the Gabrielino Tongva peoples as the traditional land caretakers of Tovangar, that is the Los Angeles Basin and South Channel Islands. Welcome to the California Health Interview Survey Data User Training. The California Health Interview Survey, we also refer to as CHIS, and we are very excited to have you all here today joining us. I'd also like to welcome our presenter and CHIS Data Dissemination Manager, Jacob Rosalez. In his role at the UCLA Center for Health Policy Research, Jacob oversees multiple internet-based public health dissemination tools powered by data from the California Health Interview Survey. That includes AskCHIS, AskCHIS Neighborhood Edition, and Health Profiles. Today, he will be walking you through how to use AskCHIS and AskCHIS Neighborhood Edition. Before we begin, I'd like to share information about some upcoming events. So 2024 actually marks the 30th anniversary of the UCLA Center for Health Policy Research, and we've got some great events planned over the next few weeks. First, and what you're seeing on the screen right now, 1 week away, we have the 2024 E.R. Brown Symposium, which is being held in person at the Hammer Museum. This year's symposium will showcase the innovations and impact that have made CHPR one of the nation's leading health policy research centers and envision the future of health policy through new advances in research, evaluation, and community engagement. Dr. Erin Carroll, President and CEO of Academy Health and a nationally recognized thought leader, pediatrician, health services researcher, and New York Times contributor, will provide the keynote address. The event is free and open to the public, but registration is required. I will be dropping that link in the chat shortly. The next event we have coming up is the 30th anniversary gala and awards dinner, which will be happening on Wednesday, November 13th. We will be celebrating the achievements that have been realized over the past 3 decades and honor the people who have been instrumental in making this work possible. We will be announcing our 30 honorees within the next couple of days, so definitely look out for that. Come and enjoy dinner, drinks, live entertainment, bid on some silent auction items. We've got front row tickets to see the Dodgers and the LA Kings. We've got a Lake Arrowhead weekend getaway and tons of other fun adventures. Join us in celebrating the strides we've made together. I am going to be posting those links in the chat. If you have any questions, I will also post my email address in the chat. Please feel free to reach out. And now I'd like to turn it over to my colleague Jacob Rosales. Jacob?
Thanks, Tiffany. Hello, everybody. I am Jacob Rosalez. I'm the Data Dissemination Manager for the CHIS. To begin, we'll go with the CHIS overview, and then we'll work on AskCHIS demo, and then AskCHIS Neighborhood Edition demo. So the California Health Interview Survey is considered the nation's largest state health survey. It's a very comprehensive source of health Californians, very, very comprehensive range of topics: health status, health conditions, mental health, oral health, access to and use of care, health insurance, respondent characteristics, sociodemographic. This year in particular, with regards to sexual orientation and gender identity, I know that we are now asking questions about sexual orientation for teens, for adolescents or teens, as well as adults, employment questions, questions on climate change, questions on guns in the household, questions on discrimination, hate incidents, and also gambling is new for this year for 2020. CHIS is a collaborative project funded by federal and state health agencies, California National Foundation, and others. So the CHIS, we interview adults ages 18 and older in the household, also adolescents, teens ages 12 to 17, and then also children ages 0 to 11. And we also conduct this survey in multiple languages: English, Spanish, Chinese, both Cantonese and Mandarin dialects, Korean, Vietnamese, and Tagalog. One thing we're focusing on is our methods. We want our methods to reflect California's diversity. For up until, I believe, in 2019, we were primarily a telephone-based survey. Now we are a multi-mode of data collection where we collect our survey responses via telephone, but also via the web, as well as we'll do sampling on prepaid cell phones, cell phone. We want to take advantage of our diverse population that we have here, so we understand the importance of a methodology in our survey that can reflect California's diverse population. So now to our AskCHIS demo. I'm taking you to the CHPR website, and for those of you that don't know, we have a revamped, redesigned website. So I'm just going to quickly walk you through how we would access AskCHIS. There's a myriad of ways. The easiest way on the website is to go to the search. We have quick links. We have AskCHIS, AskCHIS Neighborhood Edition. But before I do that, I just want to show you the tab with our work. Go to the California Health Interview Survey. Click there. And now we have Access CHIS data. And this is where we have links to AskCHIS, AskCHIS Neighborhood Edition, our health profiles, our public use files, DAC requests, and other resources. Before we get into the AskCHIS platform, I want to direct you all to our FAQs. This is our California Health Interview Survey CHIS FAQs. This is where you will find FAQs for AskCHIS. You can go down here, navigate to AskCHIS data estimates, FAQs, information on the weighting, etc. So let's just go to Access AskCHIS. Again, a lot of times you'll see buttons that say Access AskCHIS. They'll take you there. I'm just going to go back to the top. Access CHIS data. And go take me directly to the AskCHIS tool. All right. Got a slow internet connection here. There we go. So the first thing it's going to ask you to do is to sign in. If you're not signed in, register. You can click here to register for an account. Make sure whenever you do sign in, we have this whole "I'm not a robot" CAPTCHA. I know everyone's very used to it. Make sure you click on that, because if you don't, it's going to say click on the CAPTCHA. Please note that an account for AskCHIS will also be your account for AskCHIS Neighborhood Edition. They work simultaneously, hand in hand, to log in. Just clear that out. So before we get into running a query, I want to let you all know about AskCHIS. The estimates that are produced in AskCHIS are direct survey estimates. These are weighted survey estimates. They're weighted based off of the different strata that we use. The survey weights are very complex. I highly recommend you going to the FAQs and reviewing. We have a whole section in there describing the weights process. But when you are running these queries in AskCHIS, these are all weighted. So they're going to show the weighted estimate, that being the percentage, the confidence interval. You also have the ability to see the standard error. And then it's also going to show you the population. That's not the sample of survey respondents. That's the weighted universe, the weighted survey population based off of those weights. So I'm going to do a quick search all of California. You see here we have select your geographic area. If I just want to run California estimates, I just have to make sure that this search all of California is checked. You can also do different regions. You can select specific counties. You can create a custom county grouping. We also have, you have the ability to look at the Los Angeles County Service Planning areas. You don't know, if you're not familiar with them, we do provide a pop-up that shows a map of those service planning areas, or SPAs. And then we also have San Diego County Health Region. And likewise, you can get a map of those San Diego County Health Region. In this example, I'm just going to select all of California. Now I'm going to go to I can go to topic. Usually I just click up here in topic, but you also have the ability to just select the next and it'll take you to topic. When you are selecting a topic, you can either use the category selection. We have a multitude of different categories here. You select in there, then you'll see other subcategories, or you can just type in anything you want in here. It could be race, ethnicity, it could be drugs, it could be smoking, obesity. The search tool is also something that you can utilize. I'm going to look at climate change. I want to show some newer data. We just had our data release earlier this month with 2023 data. The climate change, where we had a big module of climate change questions. So let's look at climate change. Here we have a different all the different climate change variables. I'm going to select experienced extreme weather related event in the past 2 years. If I select this radio button, you'll see here that it'll present the years that this variable is available in, 2023, the age group included, adults, and then results are displayed for the following levels. So it's a yes or no. So essentially we're looking at if the number of California adults that experienced extreme weather related event. Yes, they did. No, they didn't. If you select the more option, you get more details about this variable. This is a constructed variable, names. If a respondent reported experiencing extreme heat, wildfire, smoke from a wildfire, or floods, rising sea levels, or mudslides in the past 2 years, then they were considered to have experienced an extreme weather-related event. This variable is asked to all adults, and the corresponding source variable, this is the name of the corresponding source variable that you'd be able to find in like the data dictionary, or if you were looking at want to explore this further using public use file, this is the name of the variable. I've selected that variable. I'm just going to get my data. I'm going to run this query. And we see here in this query that 61.3% of California adults experienced an extreme weather-related event in the past 2 years. We see the confidence interval as well as the weighted population estimate. So that's 17,914,000 California adults experiencing extreme weather-related event. Now, maybe when you're running your query, if you just do a statewide estimate, you might want to see what that looks like by the counties. You could go back to geographic area. One thing I like to do is I like to select compare geography. And usually what I'll do is I'll just run a big table, compare across the counties. Select this option, wait for the data to load. Now, one thing you'll notice on some of these queries is you'll get this pop-up box that says statistically unstable. And essentially it's informing you that your query results include statistically unstable estimates that we have denoted, with an asterisk. We recommend against reporting or relying on estimates that are statistically unstable. So essentially do this with caution. To help stabilize estimates, we give these recommendations: pooling years or collapsing topics. And so just we have more guidelines on that. There's the option there. Real quick on how we define an unstable data estimate is if the coefficient of variation for that estimate is greater than or equal to 0.30. The coefficient of variation is greater than or equal to 0.30, then we flag it as statistically unstable. I'm just going to select OK. For some people, we have this option here to not show that, and essentially put in this cookie so that it doesn't show you the statistically unstable estimate. I'm just going to select OK to say goodbye to that pop-up. And then we see here, Nevada County, we see that we have the unstable estimate. But this is just one way to kind of, if you want to do a quick glance at all the counties, they're going to show essentially all the counties. And please note, when I say counties, I say counties, but there are 3 different groupings. There's, as you see here, Del Norte, Siskiyou, Layton, Trinity, Modoc, Plumas, and Sierra County. That's all like one group together county. So it's this is kind of like our CHIS County strata, if you may, but I just say counties. And then we have Tehama, Glenn, and Colusa counties combined. And then Tulum, Calaveras, Amador, Inyo, Mariposa, Mono, and Alpine counties combined together. Now, another one of the many options that we have with AskCHIS is you can kind of essentially use this to whittle down things. You can whittle down your analysis. Maybe I just want to look at a specific age group. Maybe I'm just interested in, I'll just call it young. I'm going to define young adults as 18 to 25. And this is, so we have the limit population where it's essentially you're filtering the data. So I'm gonna filter by young adults 18 to 25. But also with this limit population, we have these quick variables to limit by: gender, race or ethnicity, OMB, Department of Finance. So this race ethnicity is Latino, white non-Latino, Black or African American non-Latino, American Indian, Alaska Native non-Latino, Asian non-Latino, Native Hawaiian Pacific Islander non-Latino, and then 2 or more races non-Latino. We have federal poverty level. This is continuous. So you could look at however you want to define FPL. 0 to 99% is essentially considered below poverty, but maybe you want to look at below or lower income, maybe do 0 to 199. It kind of, as the researcher, it allows you to define what your thresholds are, which is very useful, especially when you're looking at continuous levels like FPL or age. You also can just do a search for different variables to limit by. Maybe you're not interested in any of these, but you want to look at, say, asthma, obesity, whatever it is. You can type in and do a search for that. Please note, when you are limiting the data by a different variable, it will work when we have data for both years. So if, say, there's a variable from 2022 that was not included in 2023, this would not work. So it has to be a matchup for both. We have to have data for both years for it to run this way. So anyways, I'm just going to do my age, 18 to 25. I'll get my data. And now I see that it's filtered it to focus on what I'm defining as young adults, 18 to 25. To remove this filter, just hit that X button to close it out. We also have the ability to compare topics. Actually, before I go to compare topics, I want to take the focus away from the state and show you all how we can do it by our region. So we have these 7 CHIS defined regions. I'm just going to select the checkbox for each one: Northern Sierra counties, Bay Area counties, Sacramento area counties, San Joaquin Valley counties, Central Coast counties, Los Angeles County, and then other Southern California counties. And you see in here, for each one of these tables, it shows how we're defining each one of these regions. I'm going to get my data. And one thing you'll notice when I do the geographic area regions in California, initially it just creates a statewide California estimate for adults that have experienced extreme weather-related event in the past 2 years. If I go to compare geography, I can select compare geographic areas. Now the table will show the statewide estimate as well as the estimate for each one of these regions. And you'll see the same thing applies for the Los Angeles County spas. So I just select this checkbox. I get my data. Now, in this case, what it does is it provides me with a Los Angeles County specific. This is specifically Los Angeles County service planning areas. I checked all of them. So this is essentially the estimate for Los Angeles County and those adults who experienced extreme weather-related event in the past 2 years. If I go to compare geography, I can compare my geographic areas. And now you'll see that I get the estimates for each one of the different spas in San Diego County. And this is likewise the same for the San Diego County Health Region. Get my data, it runs, it creates an estimate first for all of San Diego County. I go to compare geography, I compare my geographic areas, and now I have a table showing estimates for all of the different San Diego County health regions. Now, one thing you may notice is these different regions, maybe you're looking at just a cluster of counties. Maybe you have a custom region that's outside of these regions. Perfect example is Inland Empire. So maybe I'll just consider Inland Empire as San Bernardino and Riverside County. Again, you as the user or the researcher, you can define custom county groupings however you want. I know that sometimes these regions that we have in California vary based off of the naming. So if you know a specific area of counties, grouping of counties that you want to combine together to create an estimate, all you have to do is just check the checkbox. So in this instance, I'm going to create an estimate for what I'm calling the Inland Empire, those being San Bernardino County and Riverside County. I select those. Now I get my data. And now I see the combined estimate for these two counties, 65.2% of adults in both San Bernardino County and Riverside County experienced extreme weather-related events in the past 2 years. I can compare my geographic areas, and that'll show me what each county's estimate is, as well as what the combined estimate is. I'm just going to go back to Search All California. And now I'm going to go over the compare topics. So we went over limit the population, filtering the population, but now I want to compare topics. I want to essentially create a crosstab. So I want to run a crosstab table for the state of California and adults that have experienced extreme weather-related events in the past 2 years by, I'm going to select race and ethnicity. I'll select the race OMB Department of Finance. And again, please note, if it's similar to the limit population and the compare topics, the year that I'm looking for my topic, if I'm going to compare it to another topic, they have to have concordant years. So my extreme weather related event in the past 2 years was in 2023. Therefore, my compare topics has to be a 2023 data. I see here, this variable was in 2023. It will run, it will create my crosstab. I'm going to get my data. Now I have a crosstab table, extreme weather-related event in the past 2 years for adults, with my banner variable being race. So I can see here that 56.5% of Latino adults reported they had experienced an extreme weather-related event in the past 2 years, whereas 71.3% of white non-Latinos experienced it, 53.4% Black or African American non-Latinos experienced, etc. I'm going to change this topic. I'm going to stick to climate change. But I'm going to add a new variable. So instead of experienced, I'm going to look at physical health harmed by an extreme. Actually, I'm going to do physical health harmed by an extreme weather-related event. And I select on that. I see how the results are displayed. Information on the question. Information on the universe. So this question here was asked to adults whose household experienced an extreme weather-related event in the past 2 years. So this universe will not be all adults. It will be only those adults that experienced an extreme weather-related event in the past 2 years. I'll get my data. I get the statistically unstable. And I see that for Native Hawaiian Pacific Islanders, there's instability. Now I'm going to address manners in which we can help mitigate unstable estimates. These climate change questions are new to 2023, so we really can't pool the years together. One thing that we can do is we can collapse our compare topic. So if I go to adjust layout, I can collapse my compare topic. I have two options for collapsing. I can collapse my topic. Since this is a binary variable, it really doesn't make any sense to collapse the topic. I'll discuss that in a few minutes, but we can collapse my compare topic. If I collapse my compare topic, adjusting my microphone, if I collapse my compare topic here, you see that I have these little containers, these pillboxes, if you may, and I can combine those. So what I'm going to do is I'm going to combine Native Hawaiian Pacific Islander with 2 or more races non-Latino. Select OK. And now you see I no longer have instability. Now, I understand that this is probably not the best method to go about because with regards to these race ethnicity groups, a lot of times some people will say, hey, let's just throw all of the smaller sample size groups together, the American Indian Alaska Native with the Native Hawaiian Pacific Islanders. I don't think this is a good option to do if I'm trying to do a cross tab by race ethnicity. I think it's better to just focus on the group. So I would say that this is all under your own, let your knowledge of the subject matter guide you with how you're going to collapse topics and the appropriateness of those. But this is essentially an example of how you can collapse your compare topics. Okay. Now I'm going to show you how to pool years of data. because we only have 1 year of this climate change data, there's no way to do the pooling of data. So I'm going to select a different topic that's been in the CHIS for quite a while. I'm going to remove my compare topics. And I'm going to select health status, general health status. And this is essentially a self-reported general health status question that we've been asking in the CHIS. And you see here, we've been asking this question since 2001. And respondents are asked in general, would you say your health is excellent, very good, good, fair, or poor? This is asked to essentially everyone, children, teens, and adults. And you see here that it's a 5-level variable. I'm going to get my data. Now, because this variable was asked in multiple years, we can do things like more trendy. Also, you have your charts option. You can get a bar chart or a pie chart, or you can get this trend chart. This will be a line graph. Because this is data that we've collected since 2021, be a little patient. It will load, but it's running through a lot of the data right now. And it's still loading. And now we see we have a line chart showing the trends from 2001 all the way to 2023. Keep in mind for whatever variable you select, it will show if there is more than 3 years of the data, it will show every year of the data. If you just have it on the most recent year of the data. Now, if I select 2023, 2022, 2021, 2020, and 2019, and go to get data, it will load. Here is my table. And now if I trend, it will only trend those years that I selected, 2019 to 2023. So just keep that in mind. If you want a comprehensive list, a comprehensive line chart of all years of data, just make sure that your years selected is year 2023. So now I'm going to compare my topic. Actually, before I go to compare topic, I'm going to show you all collapsing your topic. So I want to take this 5-level variable, the scale excellent, very good, good, fair, and poor, and I'm going to transform it, collapse it into just a binary. So I'm going to throw very good and good, combine that with excellent. And I'm going to take fair and poor and collapse those, combine those together. Now, this will show me that in 2023, 84.6% of all Californians, adults, children, and teens, had excellent and very good health. If you want, you can go to compare topics. Because this is an adult, child, and teen variable, maybe you want to do a crosstab by age. And now I can see the breakdown by the different age groups. Now let's revisit crosstab by race and ethnicity. Because I have this in crosstab format, if I go to trend, it's going to load the data. And then it's going to ask me which trend I want to compare. It's going to select Latino, show my trend line. And now I see this trend line is only for Latinos. If I were to rerun it, then it would ask me for a different group. Now I'm going to focus on just one specific county. I'll just do Los Angeles County. Get my data. I get the statistically unstable pop-up that comes up. And so I see here that I have some unstable estimates for American Indian and Alaska Native, Native Hawaiian Pacific Islander, and 2 or more races. Now, if I wanted to, if I was just focusing on 2023, I could collapse compare topics. And probably if I were to combine American Indian, Alaska Native with Native Hawaiian Pacific Islanders and 2 or more races, I'm pretty sure that it would probably help alleviate the instability. However, I feel that it's important to look at these groups separately as opposed to combine them, because there's just nuanced differences between them. So instead, what we can do here is, because we have multiple years of this variable, of data for this variable, let's just pull the data together. I think if I just do maybe 2 or 3, because this is LA County, it's a much larger county, you kind of have to face this pooling. A lot of the pooling is kind of it's a back and forth. In a sense, it's an iterative process that you're going to go through. I know that LA County is it's obviously the largest county in the state. So I think 3 years of data pulled together might be enough. If I were looking at a smaller county, maybe San Bernardino or Riverside County, even San Diego County, I might have to pull multiple years of data to essentially mitigate the instability. But I think 3 years of data will be enough. So I'm just going to select the checkbox for 2023, 2022, and 2021. Now, instead of the default is it says it goes to compare for multi-year options, but I'm going to select the pool radio button. I'm going to get the data. And now you see we have no pop-up, and all of my data is pooled, which essentially it's combining all years of data together. So I have more power with the sample that I'm looking at, and I no longer have the unstable estimates, and those are being defined as coefficient of variation is greater than or equal to 0.30. So my estimate for American Indian Alaska Native is stable. My estimate for Native Hawaiian Pacific Islander is stable. And my estimate for 2 or more races non-Latino is stable. I also have the option to compare to state. When I'm looking at a county or a county group, if I select compare to state, it will load this table and it will show my estimate for the specific geography that I'm looking at, and it will also show the state estimate. So here we see that my pooled estimate from 2021 to 2023, Latinos in Los Angeles County, 78.2% Latinos in Los Angeles County had excellent, very good, or good health compared to 81.9% in the entire state. I see, and I also see the estimate for those that had fair or poor health. Now you may have this information very useful for you. You have the option to export the data, because maybe you don't just want to take a snapshot of this or a snippet. You can export it. It'll export into an Excel file. And I will show you what that file looks like. And now I get everything in Excel. So now you have these raw estimates, and you can manipulate them, create your own custom graphs. Shows you the date it was created on, as well as what the source is. So this is 2021, 2022, 2023 California Health Interview Survey. And you see here that the export, it's exporting it as excellent, very good, and good by Los Angeles County. So this excellent, very good, and good combined or collapsed together. The topics collapsed together, and then it's showing the crosstabs by the different race and ethnic groups. Just going to remove the compare topics just to show what it is. If I go to my trend, this will show a trend, a line graph for Los Angeles County. Now, when I go to export this, it'll export it as a worksheet. If I right click in here, I can save this image, or you can do a snippet feature as well, or you have the print option. If I hit on print, it'll do a PDF. You can save as PDF if you want, or print out to your printer. They can't see. Okay, people are saying they can't see the exported data. Thank you, Tiffany. Let me get back to my exported data. So this is what the exported data will look like in your Excel file that you export. Gives me a description of what my table is. It's health status compared by race, ethnicity, by county or county group Los Angeles, so say the geography. And then because in this example here, I collapsed my topics, it's going to show the collapsed excellent, very good, and good collapsed together by Los Angeles County, as well as that collapsed by the entire state. And then the fair and poor collapsed by Los Angeles County, and the fair and poor collapsed by the entire state. as well as the different banner variables, the crosstab of race, ethnicity. Okay, so that is the portion of the AskCHIS. As you can see, this is a very useful tool. You have a lot of on-the-fly ability to will down, funnel down your queries. You don't just have to look at the entire state. You can look at specific counties. You can also look at sub-county level if you're in Los Angeles County or if you're in San Diego County. Los Angeles County, you can investigate. You can get estimates for the Los Angeles County service planning areas, and in San Diego County, you can get the health, human services, health region. Now we're going to move to AskCHIS Neighborhood Edition. I'm going to go back to our work, California Health Interview Survey. So AskCHIS Neighborhood Edition is, I guess you would say, little brother, whatever you want to call it, to AskCHIS. And Neighborhood Edition, we call it Neighborhood Edition because we're looking at smaller geography than what we have in AskCHIS. The AskCHIS Neighborhood Edition are modeled estimates we use small area estimation. And so these aren't direct survey estimates, these are modeled estimates. And we are able to create these modeled estimates for geographies such as legislative districts, those being your congressional districts, your state assembly districts, your state senate districts, zip codes, cities, and census tracts. AskCHIS Neighborhood Edition also has county level estimates as well as a statewide estimate. Data is available on health status, mental health, delays in care, insurance status, food insecurity, tobacco, asthma, diabetes, heart disease, obesity, oral health, sugar drinks. We also have sociodemographic estimates from the American Community Survey. And then we also provide estimates from the Cal EnviroScreen, environmental factor estimates on lead levels in water, clean on O2 in the air, clean air, and other measures as well for environment. And then we also have a handful of health indices. So when we're going to AskCHIS Neighborhood Edition, you see here in the, go back to our work, California Health Interview Survey, access CHIS data. Go to AskCHIS NE. And this option here, we'll go to read more about AskCHIS NE. For anyone that's new and not very familiar with AskCHIS NE, I highly recommend reviewing this page as well as our methodology section. It's right here in this. It's right there in that option. We have our methodology, general information, data limitations and use, methodology brief, the geographic information. This is information about the different geographies and how we define them, etc. FAQs, as well as the contact us. Now let's go to the AskCHIS Neighborhood Edition dashboard. On the Getting Started page, the very first thing that pops up is we have some YouTube tutorials. These are about roughly 3 to 4 minutes long. We have a tutorial on how to create a map and a tutorial video on how to create a table. I won't play those because I'm going to show you how to do both. So let's go into it. We'll go to Create Map. My dashboard is loading. Please note that when you see the spinning wheel at the beginning and your dashboard begins to load, I highly recommend not to click any buttons. This is just kind of like this is my approach to any kind of online platform. Once I see that spinning wheel, that's my cue to just don't do anything. No mouse clicks, no keyboard strokes or anything. Let the application load. So we see here, the default is on my create map, my map loads up. I get a core plus map of the state of California. And so what's being presented here? So I'm looking at adults ages 18 and older who were ever diagnosed with asthma by a doctor. I get a data table with the California-wide estimate, and then I see a core plus map by county, by all the California counties. See, I have a legend here. Now on the right-hand side of the map, I have these different drop-down options. So I can get my estimate. Right now, the default is set to our most current year, which is 2021 and 2022 data. But I can get 2019 and 2020, 2017 and 2018, 2015 and 2016, 2010, 2015, 2013 to 2014, and 2011 to 2012. My geography type. So if I change this, I can see my map will change to from county is the default, and it will switch to city. You can look at my assembly districts. Please note that for the 2021 and 2022 data, we are using the updated, the new boundaries for our legislative districts. So for the state assembly districts, the state senate districts, and the congressional districts, districts were realigned, districts were changed. So you'll notice that if I switch from 2021 to 2022 and go to 2019 to 2020, I'm going to see some of the polygons here will change. And that was because there was a district realignment. You won't see any change of counties because there was no changing in the boundaries for the counties. There were some slight changes with some of the city boundaries. We're utilizing shape files from the census, census Tigerline shape files, if you're all familiar with it. Census tracts did change, so you will notice some of the older census tracts that we used previously. They may be cut in half, they may be bigger, they may be smaller for the 2021 and 2022 years. Real quick, if I'm looking at census tract, please note that we only provide estimates at the census tract level from 2015 to 2016 and beyond. So if you go to 2013 and 2014, you will not be able to view census tracts. We did not provide census tract level estimates for 2013 and 2014 or 2011 and 2012. Before I go into more detail about the creating map with census tracts, I'm just going to go to the county. Here you see I have my core plus map depicting adults with asthma 18 and older. Now, if I hover over a polygon here, I'll just call it, I say polygon because that's kind of like the GIS term. But if I hover over a county, so I'm going to hover over, this is San Bernardino County. I get a tooltip that pops up. It tells me information, what's the geography type, what's the year, what is the indicator, my estimate. So it's telling me that 16.6% of adults 18 and older were ever diagnosed with asthma by a doctor. Provides me with a 95% confidence interval. And the population, 1,546,000. Please note, this is not 1,546,000 adults that were ever diagnosed with asthma. This is essentially 1,546 adults are 18 and older in San Bernardino County. So the appropriate way to define this is that 16.6% of adults ages 18 and older in San Bernardino County, and adults so 16.6% of the 1,546,000 adults in San Bernardino County were diagnosed with asthma by a doctor. You'll also notice that we have a couple of widgets in the tooltip, providing you with information on race, ethnicity. So it's a bar chart showing what the Hispanic Latino population is, non-Hispanic white only, Asian only, Black only, non-Hispanic other only, mixed. These are estimates from the American Community Survey, as well as a widget showing federal poverty level, showing 0 to 138% FPL, 139 to 249% FPL, 250 to 399% FPL, and 400% and higher FPL. Now, if I click on that county, you'll notice that I get a data box showing what San Bernardino County is. I get a data table, essentially showing everything that was in that tooltip, but this allows you to compare. You also have the ability to create a custom geography. So in this instance, I want to do a custom county grouping. So I want to group San Bernardino County, Riverside County, and Imperial County together. To do that, if I hit the control button, and now if I click on Riverside County, and then I also click on Imperial County, you'll see I get a text, a table below San Bernardino County showing the user-defined geography group. And what it does is it calculates what the estimate is for these three counties combined. It gives you your 95% confidence interval and what the population is. If I click outside of that, it'll essentially negate, it'll turn off my user-defined geography table and my county geography table. Please note, you can utilize a lasso tool, a radial tool, or a rectangle tool. So maybe I have a lasso tool and I just want to lasso the counties. And this one I'm going to combine San Diego, Orange County, Riverside County, and Imperial County together. I lasso them together, and I also create my user-defined geography. Now we'll go to census tract. Actually, before we go to census tract, I'm going to go to zip code. Run my map up as a zip code. And you see the default, it always shows the entire state of California, but maybe I want to look at, let's look specifically at Los Angeles County. So I have this magnifying glass search map. I start typing. I'm going to select Los Angeles County. And what it does is it essentially zooms me into LA County. I have these different zip codes in here. Maybe I want to be more specific. Maybe I want to look at West Hollywood specifically. So if I start typing West Hollywood in there, it'll zoom me closer into the West Hollywood area. This search with the magnifying glass does not allow you to search for addresses. So it'll only look up like cities and counties. And it also allows you to do zip codes. So if I do, this is one that I have 90210. So if I go straight to 90210, it's going to zoom me straight to where 90210 is. Whenever you zoom in and out of the map, if you hit the home button, zoom home, it will zoom you back to just kind of like a California level zoom. So please note that if you're ever, in here, and you can also zoom by just using your scroll wheel on your mouse to zoom in and out. And then you can drag your mouse, click and drag to pan it around. Maybe I want to look at Alameda, the city, Alameda, California, and it will zoom me closer in there and I can see Alameda, Oakland, Berkeley, etc. There's some easy navigation tips for using zip codes. Now let's go to census tract. I have my census tract map up. This is depicting adults ages 18 and older who were ever diagnosed with asthma by a doctor. Again, if you want to, you can just look up San Diego. Let's go to San Diego County. And you notice here, as I go into census tracts, that some of these, especially when I look at like San Diego proper and like the downtown area, they're very, very small. So I really have to zoom in to get a better feel for those. Also, you'll notice that as you hover over these tracks, each one is just essentially named San Diego County. So I'm hovered over San Diego County tract number 42. There's no like city name attached to a tract. It's just kind of the county name and then what the tract number is. So for some people, a lot of people, even myself, I couldn't tell you off the top of my head what tract I'm in. So we have some tools here that can help you find a tract pretty easily utilizing an address lookup. So I'm going to just type in the address for where our center is, 0960 Wilshire Boulevard. Make sure you add the state. So you saw that if I didn't add the state, then it said unable to find it. So if you add the state, that's very important. So it has what the track name is. And so we have this table here with our results. And essentially we have 2022. So base this off of what year you're looking at, what years you're looking at. So if I'm looking at census tract, if I'm looking at data from say 2019, 2020, I would want to use this tract name. You see that there was a change in the tract name, and that was because the boundaries got redefined. And likewise, we also provide what congressional district, state assembly district, and state senate district is. And you'll notice here that this tract, for this address, the tract has changed, the congressional district has changed, the assembly district has changed, and the state senate district has changed. So just keep in mind that when you do a specific lookup on any one of these, that you're coinciding the name to that specific year. So I'm looking at the 2021, 2022 data. So I'm going to copy my 2022. And we have little instructions in here. Paste copy text in the geography name field, select year, make a choice in the geography type field, click on highlighted area of the map to display results. So this is where I look in the search geography name. If I paste this tract name here, it will zoom me. It'll find that specific census tract, and it'll zoom me in there. And now essentially what it does is it filters it. So if I want to remove that filter, so I've identified this is the tract, this is my tract of interest. I'm just going to hit this X to clear out what's in the search geography name box. And now everything, all of the chloropleth on the map reappears. And now I can see a comparison So I can start really investigating and navigating this and seeing, where, if there's any variation or any difference in the different tracks that I'm looking at. Now, maybe you want to do, maybe a tract isn't enough. Maybe a tract, just one specific tract. You might be looking at like a specific neighborhood. So maybe I want to look at like Westwood as a whole. What I can do is I can group these together. So I already know where I'm at. I can use my grouping, my grouping options here. So maybe I'm just going to combine this and this as just kind of like, I'm just going to define these tracks as Westwood. Again, you as the user can kind of define what you want to make these neighborhoods. If you want to call, I'm just call it the Westwood neighborhood. I can combine those three, or I could, I can make it as, and the great thing, because you notice there's a lot of census tracts, you can combine as many as you want, and it will calculate the estimate and the 95% confidence interval. I'll also note that I've been just focusing on asthma, but we have different, you can look at health topics, sociodemographics, which are from the American Community Survey, environmental factors, which are from Cal and ViroScreen, and then vulnerability indices. The sociodemographics and environmental factors are supported, they support all of the geographies. So state, county, legislative district, cities, zip codes, census tracts. You're going to get estimates for sociodemographics and the environmental factors. Now, these vulnerability indices, these are only supported through census tracts. We only have the census tracts available for them. That's all they were provided. So there weren't like any statewide vulnerability indices or countywide, etc. So it's only at the census tract level when you look at these vulnerability indices. That is creating a map, exploring the geographies through the map function of AskCHIS Neighborhood Edition. Now I want to go to create a table. I'm going to go to create a table. And my default, it just goes to asthma, ever diagnosed with asthma 18 and older, shows what that estimate is for the state of California. I get these drop downs. So here I get a radial checkbox. I'm sorry, just checkbox. And so I can check multiple years. I'm going to do that. I'm going to check 2021, 2022, 2019, 2020, and 2017 and 2018. I get those multiple years. I have my state of California estimate. Now I want to throw in, because I was looking at the Westwood area. I'll select Los Angeles County. It's going to appear in my table. I'm going to go to city. I'm going to go to my geography dropdown. I'm going to add Los Angeles as well, the city of Los Angeles. You have an option to just type in, which I think is very useful, especially when you're looking at like cities, because it's a very robust list of all the cities in California. So if you could start typing down to help you whittle it down and select what you want. And I'm also going to do the census tract that I copied. I'm just going to copy that again. Now, if I go to census tracts, go to my geographies, if I paste in that tract name, it's going to find that for me. I'm going to check that in there. Let's check. Yes. And you'll see here for my census tract, my Los Angeles County tract, I only have the estimate for 2021, 2022. There is no estimate for 2019, 2020 because that was not a tract in those years. But if I want, I can copy tract name from those previous years and check that. And so now you'll see that in 2021, 2022, the old tract is not available because it changed. There's a changing in the boundaries, but I get my 2019, 2020 estimate and my 2017 and 2018 estimate. Please note when you're creating your data table that you're limited to 5 geographies plus the state of California. Once you select more than 5, the table will hide and you'll get a warning saying like only select 5 geographies and the state of California. Now you can select as many different indicators as you want. So I'm going to just select delay in receiving care, diabetes, add these to the table. So I can make the table as big as I want with regards to the indicators and the years, but I am limited with regards to the number of geographies. So you also have this option if you just want to, you find your geographies that you want. If you want all of the data, you can just select all. Now I've created a data table. Now, maybe you want to add to your table and you want to have a custom user-defined geography. I'm going to create this Westwood custom defined Westwood geography in the map. Go back to create a table. And I had to reload the table. Add LA County. And let find my census tracts, copy that. I have my census tracts there. Excellent. I'm going to go to my census tract map. To zoom into my specific census tract that I'm interested in. This one here. And now I'm going to create my user-defined geography. I'm going to combine these tracks together. If I combine these tracks together in the map on my create table, I also have a user-defined geography. I'm sorry, there should be a scroll bar here, but there's not. As you see here, it is showing up. It's just the scroll bar is hidden. I'll have to fix that. My apologies. I do have my user-defined census tract is showing for asthma. So I can export this data here, export my data and my two data tables that I have. And let me show you what that file will look like. So the exported data that I get tells me what my indicator is, the description of the indicator, what year it is, my geography, the type of geography, what the population is, what the estimate is, 95% confidence interval on the lower bound, 95% confidence interval on the upper bound, and any notes. The notes section will be if there was anything suppressed. So suppression happens on AskCHIS Neighborhood Edition when there is an unstable estimate. So that being coefficient of variation is greater than or equal to 0.30, we will suppress the estimate. Or if the population of the geography is below 1,000. So you get your individual geographies data, and then you also get your group geographies. You get the estimates for that geographic grouping, and then you also get what the geography name is. That is AskCHIS Neighborhood Edition. For both AskCHIS NE and AskCHIS, we have a contact field. Please feel free to contact us if you're having problems running your queries, if you're confused about something, please let us know. We're more than happy to contact you and reach out and help you in any way that you need help running these. With that said, we're ready for the Q&As.
Thanks so much, Jacob. We have a bunch of questions in the Q&A right now. If you do have any, please feel free to add them. We're going to try to get to as many as we can. So since we're on AskCHIS Neighborhood Edition, is there a way to export map data to a data file that can be plugged into ArcGIS or another program?
Yes, take the export data option that I showed on the data table. That's going to give you the name of the geographies. You're going to have to, it's not going to be something that you can just, throw into ArcGIS and it's going to match, it's going to pair perfectly, but it's going to have similar geography names as what we have in the shape files. It doesn't include the GeoID or like the FIPS. I think a lot of like Tiger Line shape files from Census include like FIPS. And we don't include those GeoIDs. We just include kind of like the run-of-the-mill generic name that they have.
Thank you. Another question about AskCHIS Neighborhood Edition. Someone says, I used this database before the recent change. I'm collecting data specifically for the city of West Covina, but with the new update, I noticed that many indicators don't show data when selecting city as a geographic type. Why are these indicators, for example, Cal Enviro screen, education, ethnicity, gender, race, not showing data for city?
For city, there may be suppression because of the population. If you can send us an email at chiz@ucla.edu, specifically telling us what cities and areas you're interested in, we can look into that further.
Thank you. And I just dropped that link in the chat. So on AskCHIS, somebody asks, is it possible to get disaggregated race data on Asian, Native Hawaiian, and Pacific Islander populations? That question was asked a couple times, actually. If you wouldn't mind just pulling up AskCHIS.
Yes, let's go to AskCHIS. Actually, I'm just going to do a new tab. Another thing, AskCHIS. I find one of the easiest ways to get to AskCHIS for myself is just going straight to Google. If I type AskCHIS in, my very first prompt is AskCHIS. Likewise, if I type in AskCHIS NE.
I do the same.
Yeah. So for some groups, yes, there is a way to get more disaggregation. For the NHPI, that is, I don't believe that is an option. I think it's just, so if you go into demographic here, if you go to race ethnicity, I know I was just kind of using the race OMB and it's kind of like their, essentially like Asian pan-ethnic grouping is just Asian, collapse all Asians together. But we have Asian ethnicity groups. I think this might be something of interest where, it kind of like breaks it down a little bit more, cuts it up more: Chinese, Japanese, Korean, Filipino, South Asian, Vietnamese, other Asian. We have a Latino Hispanic origin. Granted, I mean, it's just a binary. But then we also have, so we have Hispanic Latino ethnic groups. So this kind of like cuts out, this kind of like whittles down that pan-ethnic grouping. As well as we have a MENA category, so Middle East and North Africa origin. These any mentions of might be useful, because I know with some, a lot of the race group ones, it's essentially kind of like based off of the questions. If someone is multiracial, they identify with multiple races. We will ask like, what race do you identify with the most? And that will help kind of like that's part of the race scheme. I would definitely recommend looking in the our methodology for the CHIS. But these any mentions of, especially like when you're looking at like a Pacific Islander, because I know that it's a very small sample, and sometimes we may have individuals in California that are a multi, and I think this is something that we're just seeing in general, especially in California, is that we're seeing folks that are identifying as they're Pacific Islander, they're Hispanic Latino, and they're also African American. So this any mention is a way to kind of like, I guess, in a sense, increase the sample. So if you select this any mention Pacific Islander, this is a good way to do the compare topic or limit population. You might see that we have more of a sample of the any mention than when we do the race group. There's beyond that, especially for NHPI, there's not going to, we don't have any kind of a disaggregated grouping. And I think part of it is because the sample is always small. I would recommend looking into putting in a DAC request for those smaller populations, and seeing if there's some sort of a DAC project that can be done. But that is a very good question. But I do think any mentions of is a good way to also try to do that. And I think also, especially with Pacific Islander, you're most likely going to have to pull years together when you're trying to do a cross tab of like, well, whatever the indicator is, and you want to look at by the NHPI. I would definitely recommend pooling the years to boost the sample size.
Thank you. And I just dropped that link to the DAC or Data Access Center in the chat for folks who are interested in learning more about that. Can we transpose data results so yes or no is in columns and counties or in rows?
Cross counties. No, you can't.
Okay. Thank you.
What you could do is, I think, so let's do this. I just selected those multiple counties. To compare geography, compare geographic areas. So I selected a handful of geographies: Butte, Humboldt, Mendocino, Tehama, Yuba. Okay. Again, no, you can't. What you'd have to do is, I hate to say this, but you'd have to do essentially a 1-by-1. So I'm not going to use Butte because I know it's going to be too small. We'll just do Los Angeles County. So essentially, you'd have to go get data, LA County. Actually, you know why? Because I'm sorry, I'm not comparing. I have to do compare. So let's do health status, general health. I'm just going to turn off that. So here I have Pacific Islander, not Pacific Islander, and health status. I compare across counties, generate my table. There's a lot of suppressed ones. So it will, I think this example, this question here, play around with it. I'm not sure if it's going to meet your specific need. It may or may not.
Thank you. While you were on that, I noticed you were able to select multiple counties. Someone asked if you can select more than 5 because they thought the limit was 5.
The limit is 5 in AskCHIS Neighborhood Edition, and AskCHIS, however many you want. We don't cap a limit on that in AskCHIS. It's as many as you want.
And then someone asks, are there counties which cannot be analyzed individually, perhaps because the response numbers were too low? And I think you just showed a second ago some of those grouped.
Yes, so we do suppression based off of the sample size. But then also you'll notice here, I have this table set up so it's compared by the counties. So you see Del Norte, Siskiyou, Layton, Trinity, Modoc, Puma, Sierra. These are all counties, but we group them together. So this is essentially what we call CHIS counties, part of our CHIS strata. So with our sample design, we decided to group these more rural counties together. And there's 3 of them. Tehama, Glenn-Colusa is another grouping, and then Tulum, Calaveras, Amador, Inyo, Mariposa, Mono, and Alpine is the 3rd grouping.
Thank you. I'm going to ask 2 more questions. One, somebody says, would it be possible to include more sub-county geographic aggregations? And they also say we could provide the shape maps if that would help.
So if this is an AskCHIS Neighborhood Edition question,
it was AskCHIS.
AskCHIS. The reason why we're limiting the counties and then the sub-counties we only have for LA County Spa and San Diego Health regions is because it's part of the sampling, part of the sample design. And so if it's something smaller than that, I don't think that's possible. I think that's a question that you would have to send us in chiz@ucla.edu.
You. And one last question. And I'm just asking this because I think it's a good question. Is there a way to know what part of the year the data was collected in? For example, there may be differences in responses after March 2020 for questions affected by COVID-19 lockdowns, or differences in responses after October 7th for hate-related questions.
We do not have that in AskCHIS. That is something that you'd want to apply to for a DAC project for.
And I dropped that link to the DAC website in the chat. There's also, we did have in 2020 and for a couple of years after COVID, monthly preliminary estimates. And so if you can look at some of those numbers by month, that information is also available on the CHIS website. We are out of time. Thank you to everyone for joining us today. Thank you, Jacob, for doing another one of these wonderful sessions. And we will hopefully see you next week at our Era Brown Symposium in person.
Thank
Have a
you
good
all.
day.